Thank you for tuning into our regional conversations with MCH, where our goal is to make sure people are aware that homelessness is a statewide issue, that it crosses different sectors. And with that said, our guest today is Dr. Janna Gewirtz O'Brien, who's a pediatrician, adolescent medicine physician in Hennepin County. Thank you for joining us.
Thank you.
Yeah, so what's pretty cool about this interview is, we've been working with you a little bit already this year through your role on the Housing as Health group with the Doctors for Health Equity in Minnesota here. So right off the bat, what brought you into this work and why were you willing to allow us to interview you?
Well, yeah, I got into this work about 5 years ago when I started in the world of adolescent medicine, and I started to meet many, many young people who were unstably housed or highly mobile or living in shelter. And I increasingly got involved in working with youth experiencing homelessness, and I now work in shelter and provide shelter-based healthcare, and I lead a health empowerment program for pregnant and parenting youth experiencing homelessness here in Hennepin County. So I think the thing that drove me to this work is that I started to meet young people who were among the most resilient and savvy young people I had ever met. And in spite of tremendous adversity and every barrier to accessing healthcare, to accessing housing in their lives, these young people would oftentimes thrive. And I loved working with them. They are fantastic. I think we could be doing a lot more to show our support and help them thrive in our community. So honestly, it was the young people I met who drove me to this work. And I continue to try and center them in the advocacy work we do together at Minnesota Doctors for Health Equity and in the work I do in community.
That's awesome. That's great. So we're really, honored and happy to have you here during this conversation. A lot of people think of doctors and they know like your work intersects with homelessness, but maybe not, to the details or the level of involvement you've had. So, what would be the impact of, do we need more resources? What would be the positive impacts if we get more? Would there be negative consequences if we don't? Just how do you see the need for more resources play out in your work?
Yeah, I think that's key. I think sometimes we live in sectors in the advocacy spaces. There's the housing sector, there's the healthcare sector, there's the educational sector. And I've worked even as a healthcare provider in each of these sectors, and it always surprises me that there's these kind of silos in between. And I think there is no doubt in my mind that housing is health. So health begins where we live, learn, work, and play. So if a young person does not have a place to lay their head at night, their health is dramatically impacted. So without shelter, without a stable housing situation, without a supportive home and housing situation, it's very difficult for young people to thrive and to be healthy and to be well. So I think for me as a physician, there are very few issues that are more important than the foundation of housing. So I think that's a big part of why I'm in this work, honestly. So to give an example of why specifically emergency shelter and resources are so important, if I'm sitting there with a young person and I'm having a conversation about something like asthma, a physical illness that affects the lungs and affects a person's ability to breathe, which we know is impacted by our environment, and I'm saying, I'd recommend an inhaler. And I'd recommend that you go to the pharmacy and pick up an inhaler, and then I'd recommend you go here. If they're not even having a place to lay their head at night, how can I expect them to also get to me, get to a pharmacy, there's so many more important needs that they have to have met in order to even get that asthma under control. And many of them are living in places where they're exposed to lots of secondhand smoke, or or living on the streets, living in encampments, living on public transit, honestly, or spending a lot of time there where they're exposed to lots of things that can aggravate asthma. I need to get to the foundation of it. We need to have a place for them to live and stay. So for me, honestly, my number one prescription is let's get you shelter. And then unfortunately, what happens then is there's oftentimes no shelter beds for them. So it's hard. It's really hard. And our community needs to invest in these young people who have tremendous potential and unfortunately, very few resources. So yeah, step one, prescription for housing.
Nice. Prescription for housing. That's a good tagline. And I might, to go off the cuff a little bit, just because before we started recording this interview, you know, what if you had the ability to make one thing happen for the youth that you're working with? What would be that one thing? That would it be shelter? Would it be, I don't know. What do you think is the one thing that if you could make happen?
Oh, wow. The pie in the sky dream question. You know, I think if every single young person had access to stable and supportive shelter, and then eventually transitional housing and long-term housing options, I think this across the continuum of housing based on youth needs, because there are a range of young people, even within youth who are experiencing homelessness, there's a diverse range of experiences. I think housing options across the continuum, from emergency shelter when young people are in crisis, to transitional living that's supportive for young people, to long-term housing options for young people too. I think we need to be investing in housing across the continuum. And I can speak more to what I mean when I what specific resources in shelter and in these housing programs I think would be useful. But the bottom line is housing first, and then the rest of it comes.
That's perfect. Well said. Well said. So we also like to try to end these interviews. If you have a message for those that, may be watching this, is there a message that you want to share with fellow advocates or folks even new to this work?
Well, I think the biggest message would be that when we visualize or think of a young person who is homeless, we oftentimes think of the kind of single adult on the street. That image comes to mind. And I'll ask you to kind of think about that now. I'd like you to throw that image out the window, because I really do think we need to think about housing instability and homelessness much more broadly than that. The young people I see who are experiencing homelessness or who are unstably housed often look just like every other young person that I see. If we don't ask, we won't know. And we need to be thinking about the diverse range of experiences of homelessness. And honestly, it is only when we think about that diverse range of experiences that we'll be able to identify young people who are experiencing homelessness or at risk of transitioning to homelessness early on in the process, provide them with much needed supports, and kind of wrap our arms around them as a community to be there for them and show them that we look forward to what they bring to our society and our community and all the potential that they bring for themselves and their future and their families. So I really think we need to kind of debunk this myth that homelessness looks one way, include youth in the conversation, center people with lived experiences, and make sure really make sure that we're investing in them and seeing them for what they are, which are amazing assets to our community.
Well, thank you. That was so well said. And I really hope a lot of people watch this and take that message with. Our tagline too is shelter saves lives, housing ends homelessness. So hopefully, some of the stuff that Dr. Janna has said, if you're an advocate watching this, that you can take some of this into your own advocacy. So thank you for watching. And I want to thank you again, Dr. Janna, for joining us and letting us interview you.
Well, I'm really grateful for this opportunity. Shelter absolutely saves lives, and I'm glad we're doing this work together.
Thanks.